Welcome. My name is Trishanda, and this is Leukocyte United, a nonprofit reproductive healthcare network where our primary focus is PCOS, endometriosis, fibroids, thyroids, fertility, and childbirth. Today we're going to take a brief history lesson in hysterectomy. Before we proceed, I have an urgent disclaimer. I am not a licensed medical professional. The information provided today is for educational purposes only and should not be used as a reference to your reproductive health. If you have any questions concerning your reproductive health, please contact your physician. If you do not have a physician, please email leukocytellc@gmail.com and I'll be happy to connect you with a licensed, reputable medical professional. It's a surgical procedure that removes part or all of your uterus. This may also include your cervix, your ovaries, or your fallopian tubes. Now you may be wondering, why would someone have a hysterectomy? Well, there can be many factors, but in reference to our primary focus, people who are diagnosed with fibroids or endometriosis are at higher risk of having a hysterectomy. In 1843, Charles Clay performed the first hysterectomy in Manchester, England. However, the patient was misdiagnosed and died. In 1853, Gilman Kimball performed the first successful hysterectomy. There are reports that hysterectomies were also completed in 120 AD as well as the Middle Ages. The hysterectomy is the most common non-pregnancy major surgery performed on women in the United States today. As of today, 20 million women have had a hysterectomy. 600,000 are performed a year, which averages one hysterectomy per minute. In the United Kingdom, where 75,000 hysterectomies are performed a year. In 2014, Canada reported 40,000 hysterectomies were completed. These are standardly covered by insurance as long as your doctor deems it medically necessary. This procedure costs anywhere between $3,000 to $7,000. 20 million women in the United States have had a hysterectomy. However, reports state that 1 in 5 were misdiagnosed and unnecessary, bringing the number to 1 million unnecessary hysterectomies completed in the United States. Reports state that 25% of these surgeries are completed on young women and 8% are completed on older women. African American women are 2 to 3 times more likely to have a hysterectomy at ages 25 to 44. They also experience longer hospital stays as well as a higher mortality rate. Now, a major question is, if they are unnecessary, what is the alternative? If you have fibroids, an alternative is a myomectomy, which removes the fibroids from your uterus, or uterine embolization, which cuts off the blood supply to the fibroid. Per Women's Health, the FDA warns against the use of power morcellators during fibroid surgery. Your fibroid may contain an undiagnosed cancer, and the power morcellator can spread this to other parts of your body. Be sure to ask your doctor if a power morcellator is being used. Endometriosis, it may be suggested you proceed with a laparoscopy. However, keep in mind, if you have endometriosis and have a hysterectomy, you can still have endometriosis. A method that is commonly forgotten is the holistic alternative. For people facing reproductive healthcare challenges, holistic options don't seem ideal because the pain does not subside overnight. However, take a moment to invest in your internal wellness. Instant gratification can lead to other diagnoses down the line, such as blood clots, osteoporosis, cancer, cardiac disease, and neurological diseases that can lead to dementia. Why are they being performed so often? Lack of medical due diligence and patients not knowing all of their options. Very unfortunate to say, but the financial gain that the physicians gain from these procedures, there's a high reimbursement rate. The hospitals also get paid for your hospital stay, and the pharmacies also benefit from the recovery medication that you have to take. Food for thought is, what is so special about the uterus? 18. The medical field has started the process of uterine transplants from live donors, meaning a woman has the option to donate her uterus to another woman in need. For women facing infertility and want to experience pregnancy. Majority of these programs prefer live donors. However, there are programs that work with live donors or deceased organs. Uterus also contains stem cells, which assist in the regeneration process. Leaving the question, what is done with uteruses after hysterectomies? Feel informative, leading you to take proactive measures to ensure your reproductive health. Donate to our GoFundMe at Leukocyte United, and be sure to stay connected on all of our social media platforms. On YouTube, Leukocyte United, and on Instagram, we are Leukocyte. If you have any questions about your reproductive health, need financial literacy and guidance, or just would like a support system, feel free to email leukocytellc@gmail.com. More life.